I think, unfortunately, COVID was a terrible precedent of the impacts of social determinants of health. And I think that communities of color, part of why there was a greater susceptibility to COVID and a greater degree of death and a greater degree of hospitalization and complicating factors were dealing with factors like living in multi-generational households. We tend to congregate together. We have a lot of grandparents raising grandchildren, tending to work as essential workers and frontline workers with a lot of public facing contact. And so therefore there's greater risk of exposure and transmission. And then on top of it, people of color unfortunately have a higher rate of diseases like high blood pressure, diabetes, cancer, and these conditions that can impact the immune system and the ability to ward off or to fight off things or to contend with things if the body is confronted. So all the more reason that it's time to really follow those wellness plans that we talk about at the Multicultural Health Institute, to really have good nutrition, to really get your vegetables and fruits and keep your immune system strong, to exercise, keep that positive mental attitude. All of those things keep you in a state of readiness. So if your body is confronted with something, it can handle it a little bit better. That also means if you have a chronic condition like diabetes, keeping your blood sugar under control, taking your medication, following through with your doctor's recommendation, exercising regularly, all of those things can really help with whatever might happen in terms of what your body is faced with. But we are definitely, at greater risk in the sense of the higher rates of diseases and the decreased connectedness to healthcare systems and access issues because of insurance problems and economic issues. So these are all barriers that can be overcome if we work together, stronger together as community.
Dr. Merritt, the young populations who are moving around, so to speak, and interacting, whether it be summer school or an activity of sports or any type of activity where human beings are together, can you talk about the challenges for the young populations as it relates to the monkeypox and particularly here on the Suncoast?
Well, the younger population is going to be unlikely to have received the smallpox vaccination like some of the rest of us dinosaurs. So they're more susceptible. Certainly, we hope that they're all vaccinated against COVID. I can't say that there's any cross impact in terms of having a COVID vaccination for protecting against monkeypox, but it certainly is priming your immune system to be in a state of readiness, which isn't a bad thing. And as with COVID, I still think that people need to be careful. You need to understand the status of people around you. You need to wash hands. Young people run around. They're gonna, tussle and rumble around and all of that stuff. But right now the numbers are low and the risk is very, very low. What we need to do as a community and watch the trend. And if we begin to see an increased risk, then we need to take higher precautions. People should be far more concerned about a 20% positivity rate for COVID, in which the CDC has recommended that we are in a high state of risk and everyone should be wearing masks just because of COVID alone. So those same precautions already apply to the young people in terms of their interactions. If they were to follow those recommendations, then they should be safe as well from monkeypox.
Dr. Merritt, in closing, are there any final comments or anything else you would like to share with the audience as we think about monkeypox, and again, here on the Suncoast, what people can look for and what we need to do to be healthy and safe and sound?
Well, I just want to remind everybody that July is Minority Mental Health Awareness Month. And so it's important, let's take care of ourselves. Let's not go into fear. We have lived and endured and survived many things. And let's just keep a positive mental attitude. We'll be having our monthly healing circle on July 21st with Dr. Janet Taylor at 6:30. You can see it on our Multicultural Health Institute Facebook live stream, or reach out to us if you'd like to be included on the Zoom, and learn how you can practice the best self-care techniques. And know that it all starts with your mind and what affects your body. And if we keep our minds in a good place, then our bodies will be the best that they can be as well.
Well, folks, there you have it. She is Lisa Merritt, MD. I am James Hill. We thank you so much for tuning in. We will be right back.